So today we're going to be doing a little neuromodulator, specifically Dysport, and we're going to be using it in the glabella, but not to relax these lines. Frown for me. Although it'll soften that and make her not look so upset, really the reason why we use it is because this is the muscle that pulls the brow down. So if you put a little here, it'll resuspend and bring the brow up. And if you put a little in the tail, it'll do the same here as well, so that the eye actually appears a bit more open. Because as a function of age, our brow drops a little. In a woman, you always want the brow to be about 1 millimeter to 2 millimeters beyond the bone or the orbital rim. In addition, when you look straight into the camera, you can see that people start to develop these fine lines under the eyes. So I always like to do a little drop of Dysport in there as well as right out through here, because I'm going to have you blink and close one eye really tight. Look at and keep that and close it really, really tight. Keep the other one open. You see how all of this muscle is engaging when she closes one eye? It's not just out here, it's all throughout in here as well as through here. So if I relax her bunnies and I relax here, open up your eye, it'll stretch that skin. And so it's more than just relaxing lines out here, it's relaxing the lines within the orbital rim as well. And so if you do a little bit of that, you can improve the quality and appearance of that skin. So I'm not a big proponent of putting a bunch of product. We're not trying to, again, eliminate every single line. We are just trying to improve the quality of that skin in that area and give a nice, subtle brow lift. Engage your bunnies for me. And open up your eyes. Go up, up, up. And everyone always pulls a little bit more on one side than the other. So it's important that whoever's treating you recognizes the asymmetries between one side of the face and the other, as the sides of the face are meant to be sisters, not twins. And then here I do this little drop. Look up. I always tell my patients to pretend I'm doing eyeliner. It doesn't hurt, but I know it looks a bit scary. Smile big. Then they feel like they have a little tear under their eye. And it's just a little drop of product. That goes away within about 20 minutes. And then I always do treat a little bit of the forehead, because if you relax this and relax this, all that's going to be working are the muscles that are pulling the brow up. Go up. And so you don't want to leave her with a bunch of lines here. So when I treat here, it's not because I'm trying to eliminate lines, it's just that I'm trying to make everything nice and even. So I like to sprinkle throughout the forehead. And that's it. So really not a lot of evidence, mild redness at the sites of injection. She's going to resume her daily activity. All these bumps will be down in about 5 minutes. And so that's really the nice thing with a little bit of Dysport or Botox or Xeomin. You're not adding any volume and distorting anyone's face. You're just relaxing the muscles that sometimes start to pull on the jawline or start to scrunch up the eye and cause lines and wrinkles. And so it's a nice, actual, natural way to make someone look a little bit more rested and youthful. Thank you so much. For more information, visit us at clderm.com.